Welcome to Bristol Park Hospital. My name is Dr. Michael Mutua. I'm the Executive Director of Bristol Park Hospital and the Chair of Bristol Park Group of Hospitals. It's a long history. The thought around the hospital and coming up with the hospital is really old, but generally the planning and the execution of those plans for beginning a hospital here in Nairobi started back in 2008, late, and by March 2009 we had already opened our doors to the very first clients in our first branch in Tasia Estate in Nairobi, Eastland. So far we are at 4 branches. We starting off with the very first branch in Tasia in 2009, sorry, and come 2013-14 thereabout, we started off with our second branch in Utawala Estate, another very fast growing area in Nairobi, Eastlands, and about 3 years later we went to Machakos. We opened our very first branch outside Nairobi. Which was now followed by the 4th branch, which opened in Feather Estate, again in Eastlands, Nairobi, in 2018. Generally, all our branches are, we assess the healthcare needs of the communities generally to try and understand what the needs are. We look at what kind of services are currently available, both in private and public facilities, and think about a solution that fits in the gap that we find. We don't just open a branch for the sake of opening a branch. We really want to meet the people's needs, and that is generally what informs our setups. Of course we do, and we always aspire, and our greatest aspiration is to provide healthcare services that are affordable, that are quality, and that make use of all possible innovations in technology. And this is an area that really, and it's actually what drives our healthcare service delivery. Definitely we are guided by certain principles, especially around issues of integrity and trust. We want to build on that trust, not just within ourselves, but also with our partners. We are also guided by, offering effective services and available services. It's not just about services being available, but how accessible are these services? How affordable are these services? These are things that really, bother us in terms of how do we meet our clients' needs. And definitely we also focus on quality of care and professionalism. These are the main guiding principles for our hospital. We do offer a wide range of services, both in and outpatient services in all our branches. However, we have 2 sets of hospitals. So we have 2 of our branches are level 3 hospitals according to Ministry of Health classification of hospitals, and 2 of them are level 4 hospitals. So all these branches offer different services, but a wide range of them. So in our outpatient area, you're definitely going to find our general consultation services. You're going to have laboratory services. You're going to have a pharmacy offering medication, both prescription and over-the-counter medications. You're going to have radiology services there, dental services there. In terms of inpatient services, we have also expanded our service offering in almost all our branches, and all the way from general inpatient management of patients to all having theater procedures done in our facilities. So it's a wide range of services that we try to offer as much as as we assess the needs of the communities around us. We do work, and over the years, I say that we have been here for the last 12, 13 years, and over that period we have continued to build partnerships with so many insurance companies. A majority of them we have partnered with. I would say we accept nearly all insurance companies' cards that we have signed up with. And this number has been growing over the years as new insurance companies come up, and we always want to invite our clients every time a new insurance company comes up that we is not on our medical insurance list. We always engage them because ours is to ensure no client misses out on our services. I think generally it should be something around our consistency of service delivery and reliability. This is one of the things that we have really focused on. Going back to when we started off, I do not remember any hospital or healthcare facility in Eastland that was actually open on 24-hour basis. And we looked at the kind of needs that were in this general area. The number of people who live around here. And we used to have huge traffic jams on Outer Ring Road, and I couldn't imagine what it takes to manage emergencies in Eastlands. And one of the things that we devoted ourselves, and I personally committed myself, is to ensure that all our services will always be available on 24-hour basis, 365 days in a year. Definitely, like in any other business, there are highs and lows. Sorry, and one of the things that I must mention for us, these are daily encounters. But my greatest low is every time I see a dissatisfied client, someone who is not happy with our services. That is one of the things that almost nearly depresses me, because it is our effort. We make every effort on a daily basis to ensure that we meet our clients' needs. But again, it's not always the case, and some of the times, we miss out on a little of that. However, of course, we also have our own highs. Every time we are reaching out to new segments. Like when we opened up our branch in Machakos. For us, it was really captivating, because it wasn't an area we really understood. It was a new market for us. It was a new community for us, and seeing it pick up, seeing people really appreciate the services that we were offering there. To me personally, I think it was really a high. But most importantly, I think for us, it's the satisfaction of the clients. Every time a client gives us that, recommendation, to me personally, it's key, the client experience. And every time we get those negative feedback, of course, they are very good. We always encourage every kind of feedback. But I think just recently, and as for every other business, COVID-19 came, and this is one of the things that really affected many businesses, especially self-financing institutions. And healthcare was not really was not spared by the pandemic, and I feel like it was a huge shake-up for us. Called for a lot of going back to our principles and thinking about how can we still sustain the service delivery without necessarily affecting either our clients or our staff. Yeah, so it was a low moment for us, but things are slowly picking up, and we really appreciate and we thank God that everything is coming back to normal. Oh, certainly. Of course, we tend to look at ourselves in terms of 5 years, looking at our strategic plans. But 10 years, that's like two strategic cycles, and we see ourselves being one of the leading quality healthcare service providers, not just in Eastland, so not just in Nairobi, but in the entire country, Kenya, and also outside the country. And we are looking at expanding very strategically, depending on the needs of healthcare, or rather the healthcare needs of communities in different regions. And of course, this is going to be driven by the kind of partnerships that we are developing, not just with our clients, but also with other corporates. And for us, we see a bright 10 years from now, and we're also looking at expanding our service offering. We want to be that world-class healthcare service provider in the entire Africa. It is doable. And in 10 years, it's achievable. Generally, healthcare service delivery has been affected, in all manner of ways. It started off as a scare, where everyone was running away from hospitals. No one wanted to seek healthcare services in hospitals because they thought, those were healthcare, or rather hospital environments were likely to be the super spreaders. However, people are slowly and have slowly started appreciating the role that both private and public healthcare service providers are playing in the pandemic and the management of the pandemic. However, I mean, just like any other organization, it was, when it started, it was a wake-up call for us and for many other industries. We had to look back within ourselves and think about how can we still sustain our model of service delivery. And I would say that proudly that we are one of the organizations that in the midst of that pandemic, we immediately started thinking about how can we leverage on our clients and ensure that clients can still afford the healthcare services that we provide. We revisited our price list, to ensure that we make our healthcare services even more affordable to our clients. We also looked back within ourselves and our staff. Everyone was laying off their personnel left, right, and center. And the one thing that we determined in ourselves is to make sure that we do not lose any of our human capital. And I would proudly say that we have achieved that so far. We have actually maintained everyone in our staff list, and we continue to look for brighter future where we can continue delivering services in partnership with so many other partners. Working with the government to ensure implementation of the guidelines and protocols that have been issued on COVID-19 management. It's of course definitely it's a challenge for everyone, but we are seeing a brighter future by the day and by the minute. Yes. A good thing is that a lot of information has been relayed on all different types of media and channels. Almost everyone now knows what are the do's and the don'ts when it comes to avoiding contracting, or how to protect ourselves from contracting COVID-19. Of course, issues of washing hands, wearing, putting on your mask, avoiding crowded areas, and gatherings. This information is out right there. There are even songs about it. The only thing is, can we be truthful to ourselves? Can we really ensure that we maintain those guidelines? And if that is done, it's going to be very easy. We manage lots of cases within our facilities, and for me as a person, I would comfortably want to say that COVID is real. We are receiving so many cases of clients who've contracted COVID. We are losing patients. And if it is possible to avoid contracting these virus, it is worth making the effort here. just to thank our clients, our partners, people who have worked with us right from back in 2009, people who trusted in our services. I know a number of clients, a number of partners that we started back in 2009 together, and we are still continuing this partnership. It has been a long journey, and I really do appreciate their effort to continue these partnerships, and we pray and hope that this is going to grow even stronger over the years, and looking at not just insurance partnerships with insurance companies, also the partnerships that we have had with other corporates, partnerships we have had with them, the ministries, especially Ministry of Health. They are growing stronger by the day, and we really do appreciate some of those stakeholders that we have interacted with over the years.